The Acoustic Neuroma Association, celebrating 25 years of providing information and support for the acoustic neuroma patient.
This organization grew out of one person's need, and that was me. I probably went into surgery as one of the most uninformed patients. I couldn't find literature to speak of for the patient with a large tumor and a 17-hour surgery. When I looked at myself in the mirror and saw my damaged face, I could not speak distinctly. My speech was slurred. I had chronic eye infections, and I knew that my life as a normal appearing and normal functioning person was over. But I had a great hunger, a need to find one other person who had walked the same path as I had, and there was no one.
Jenny's surgeon put her in touch with an acoustic neuroma patient living near her in Philadelphia.
We found that we had a common need. And so we determined to try to find some other people. And we did. And our numbers grew to 8, a dozen, about 20 people.
The board of directors consists of acoustic neuroma patients. Under their leadership, hard work, and dedication, the membership grew to 5,000 people. The ANA was designated a nonprofit 501c3 organization. Sally Anderson, the second ANA board president, established headquarters in Atlanta, Georgia. Sally and Lois White, ANA executive director, set about meeting their members' needs.
I was first involved with ANA in the mid-80s. As we talked to people, we became more familiar with some things that they wanted to know. That's how the booklet about headaches came into existence and the books about balance. We have always used physicians and our medical advisory board to help us come up with the medical information needed to go into those booklets.
The ANA Medical Advisory Board consists of healthcare professionals who work in the fields of diagnosis, treatment, and recovery for acoustic neuroma patients. They oversee all written medical materials that the ANA publishes and contribute articles to the quarterly newsletter. They sponsor and speak at the ANA National Symposiums.
One of the most important roles of the ANA is to direct patients to treatment centers that are experienced in the management of acoustic neuromas, whatever the treatment may be: observation, microsurgery, or radiosurgery.
Dr. Daryl E. Brackman, speaking about the history of acoustic neuroma research and treatment.
The advancement in the treatment of acoustic neuromas is due to the pioneering work of Dr. William House. He introduced the microscope to surgery, enabling neurosurgeons and otolaryngologists a precise view of the tumor and surrounding nerves. He developed new techniques to approach the tumor and tools to perform more accurate, delicate procedures, resulting in the preservation of facial nerves and hearing in patients. He broke barriers between neurosurgeons and otolaryngologists. Today, the ANA recommends the team approach as the standard for acoustic neuroma management. Technology has evolved with the CT scan and the MRI, making early diagnosis possible.
The 1998 member survey provided a larger picture of the quality of life acoustic neuroma patients were experiencing, sometimes several years after surgery. The survey also documented changes in patient outcomes due to the advancements in medical technology. The Internet came into popular use in the late 1990s. Patients, family members, and friends were accessing the ANA website to ask their most pressing questions.
When I first came to ANA in '96, the board had begun to recognize that there was a change in the type of patients that we served. Initially, it served primarily the post-treatment patient. We began to find that we were seeing more and more pre-treatment patients. When we find out in the office that someone has just been newly diagnosed, geographically we figure out where they are and send them the appropriate support group information. They want to talk to somebody today, right now. And we developed a list of what we call, we developed something called our WTT list. That's our willing to talk list. We would put folks literally in touch with each other via the telephone. Then there was also the ANA website had a section on it where messages could be posted. The organization itself kind of serves as a central clearinghouse, and patient calls into the organization. Organization gives out names of other folks and so on, so the word gets spread that way.
We feel that it is so important for patients to be educated. We have found, and we hear stories all the time, that patients who are the most educated, who have done all of their research, who make sure that they understand all the treatment options, who get several opinions also, generally have the best treatment outcomes as well.
I was diagnosed with a 3.4 centimeter acoustic neuroma. When I first looked into the mirror, I cried. I learned that there are over 10,000 facial nerve fibers that need to regenerate over time. My doctor suggested I visit a physical therapist to evaluate my face. Today, I am alive and so grateful to be a wife and a mother.
The vision for the Acoustic Neuroma Association in the future is that we want to be an organization that patients first come to for when they are researching and educating themselves about an acoustic neuroma.
I think the thing that I am proudest of is the fact that today there is an organization in place to supply support and information to people who have been diagnosed with something that leaves them traumatized. They can talk face to face with others who have walked the same path and hear these magic, glorious words. I understand. I've been there. Tell me about it. Maybe I found something that can help with your problem. I didn't have that opportunity, and I'm glad I provided it for others.
The mission of the ANA is to inform, educate, and provide national and local support networks for those affected by acoustic neuromas. We are also an essential resource for healthcare professionals.